All right, Compassion and Choices has come out with a video that claims to debunk myths and misconceptions about the physician-assisted suicide bill on Kathy Hochul's desk. Let's do some debunking of our own. We are not going to hit every point that they make in this video because they make a lot. We'll hit the low-hanging fruit, and so I'm going to jump to where they hit the strongest safeguards in the nation bit a little heavier here.
And only if they have 6 months or less to live and have full mental capacity.
In reality, New York's law has the strongest safeguards in the nation. Mandatory mental health screenings, independent witnesses, multiple requests, and the opportunity to withdraw a request at...
Okay, if I'm trying to sell you a car and I say, well, it's the best car ever made. It's got 4 wheels, it's got a windshield, it's got Bluetooth, and it's got a great steering wheel that doesn't fly out of your hand while driving.
A great steering wheel that doesn't whip out of the window while I'm driving.
You'd be like, isn't that every car on the road nowadays? So it's bizarre that Compassion and Choices is doing the exact same thing with the physician-assisted suicide law here. Mandatory mental health screenings. Those are on the books in every single state where physician-assisted suicide has been legalized. They're not used, they don't work, they're used in less than 1% of all cases, but I digress. Independent witnesses. Those are on the books in every state where this is legal. Multiple requests. Those are on the books in every state where this is legal. And you guessed it, the opportunity to withdraw a request are also on the books everywhere where this is legal. So how does this make New York the safest state with the strongest safeguards that we've seen? It's hard to have a good faith argument with someone when they lie like this. I wish I could say that this is a misleading statement or a fib. It's an outright lie because not only does New York not have the safest safeguards in the country, this is by far the most dangerous and radical bill that has ever been passed in the United States. So just to compare it against the Death with Dignity Act from Oregon in 1997, which is called like the Oregon model. It's still cited in the UK while they're debating this. And it's just seen around the world as like, this is the way to do physician-assisted suicide. That bill had a 15-day waiting period. So from the day that you get approved for physician-assisted suicide to the day that you get administered the poison to end your own life, you get 15 days to protect you in case you're having a mental health breakdown or an episode or you're behaving rashly or you have second thoughts. New York's waiting period is 0 days. To pretend that this is equivalent is crazy. New York also does not have a residency requirement. So a state that has the tourism capital of America, New York City, does not require you to be a New York resident. And the bill does not have anything that requires physicians to have in-person consults with patients. But this is by far the most dangerous bill that's ever been passed in the United States. Let's keep going.
Some fear doctors or nurses could give the medication to a patient. That's not allowed. The patient must ingest the medication on their own. No one else can do it for them.
Okay, first of all, I love the little Freudian slip. Doctors or nurses will give this to patients. The bill currently specifies only physicians, but Compassion and Choices is fighting like crazy to expand this to nurses, PAs, things like that. So that was interesting. But this is kind of odd. People are saying that doctors and nurses can give this to the patients, but that's false. The patient must ingest the medication on their own. No one else can do it for them. I've never heard of anyone ingesting something for someone else. It's kind of an odd word choice. Compassion Choices stopped saying self-administer. They now say self-ingest. Why? Because ingest means just to digest, to be able to swallow the pill. Theoretically, you actually could be provided this pill by a doctor, by a nurse, by a family member, by somebody, which used to not be the rule. Again, in the initial Oregon law, it was required that you had to self-administer this. When someone else administers it to you, that's called euthanasia. This law says that you have to ingest it, but pretends that ingest means administer. Forgive me if I'm still hyper skeptical as to whether this will be used for coercion or not.
Some say insurance companies will deny life-saving treatment to push people to choose medical aid in dying. That's wrong.
Try telling that to Stephanie Packer, who was denied life-saving treatment but was offered physician-assisted suicide for a $1.20 copay.
I got a letter that said my life-extending treatments were not going to be covered anymore. I called them and found out that for $1.20, instead of life-extending treatments, I could end my life.
But I digress.
Entirely different from those in Canada. U.S. laws are more strict, ensuring that only adults with a terminal illness can ask for medical aid in dying, and they alone make the decision and self-ingest the medication.
Is this a slippery slope toward the Canadian or European model? No. The strict core eligibility criteria for medical aid in dying has remained unchanged for over a quarter of a century since the first aid in dying law was adopted in the US in 1994. 11 more have been adopted since then.
Okay, so you'll note that he first frames it as, is this a slippery slope towards Canada or Europe, which is a nice framing because here in the United States, we've actually, regardless of what you think of healthcare, the reason physician-assisted suicide hasn't expanded as rapidly as it has in Canada and Europe is because we don't have a single-payer system. It's federally overseen, but there's private providers, and then there's states that administer federal funds. So the reason it spread so quickly in Canada and Europe is because once you're in the federal level, you're through. And that's why this fight is so intense in the UK right now. In the US, they've had to go state by state. So that's the main reason that this hasn't reached Canada and Europe's levels. But the other thing to cover here is that there is a slippery slope in the United States. Almost every main guardrail has been changed. Again, waiting period, that's been removed in many jurisdictions. The requirement that it be a physician to administer this to you, that's been changed in many jurisdictions. The requirement that you be a state resident, that's been changed in many jurisdictions. A lot of the safeguards that have been put into place, like the mental health screenings, don't work, they're not used. Oregon's trying to get rid of theirs. And then, of course, New York's just jumping, they're not even trying to introduce these things in the first place. Again, you can get physician-assisted suicide by mail, you can get telehealth consults. And then the last thing he said, this was passed in 1994, and it's been passed in 11 other places since then. That seems to be a bit of a slippery slope, like an increase in access. And Compassionate Choices, by the way, has tried to push this through 20 other states just this past year. So again, the idea that there's not a slippery slope here is one of the most thoroughly disproven things that's out there. The question isn't whether a slippery slope exists, it's whether you're okay with the slippery slope that exists.
Another myth? No oversight. In fact, physicians must report every case, and the Department of Health must issue annual public reports while keeping identities private.
Okay. The idea that physicians have to submit forms. There's research that shows physicians don't submit as many as half of the forms on this stuff and that they're missing and that the reporting on this is a mess. We do a report of this every single year in our data tracker at assistedsuicidewatch.org. They change the death counts after every year. All sorts of data gets changed on a year-over-year basis. There's gaps in the data. There's no regulation as to making sure states all report the data in the same way. And then New Mexico has never filed a report on the data from this. Washington, D.C. hasn't done it the last 2 years. The state of Washington tried to remove from their website add a thing to their website that said, hey, we're not going to do it this year because federal funds have been cut, which is also kind of odd considering federal funds are literally banned from supporting physician-assisted suicide, but I digress. And it wasn't until we and others called them on it that they then said begrudgingly, okay, fine, we'll submit an annual report so that we're following state law. We're still waiting on that report. So again, the idea that this is a guardrail that ensures transparency, that has not worked out in practice. I think that's the
What
end.
about life insurance? The law explicitly protects it. Policies and benefits are not affected. In fact, no family has ever been denied life insurance in any other state because a loved one used medical aid in dying.
Yeah, this is an interesting one to include because I think most people's fears about the life insurance angle isn't that life insurance claims would be denied by some, if the person that had the insurance policy died from physician-assisted suicide. I think most of us are concerned because we're afraid that people that are beneficiaries to life insurance policies would coerce loved ones to get physician-assisted suicide so that they could get the payoff from that life insurance plan. So that's kind of an odd one to include here. But look, that's the gist of it. Compassionate Choices here is just spreading propaganda about this law. I think we can have a good faith debate on this. Like the slippery slope question, it's not so much does it exist, but is it an acceptable slope? Are there ways that we can curb this? Are there lessons we can take from Canada? You can have a debate about this. But it's hard to have a good faith debate when you're peddling around propaganda like this that has no bearing on reality. So New Yorkers, you can do better than this bill. If you want to learn more about how to respect human dignity at the end of life and how you can find hope at the end of life, I encourage you to visit agingwithdignity.org. And if you want to learn more about the issue of physician-assisted suicide, you can visit assistedsuicidewatch.org.